but maybe you could explain once more what we do know and what is your opinion at the moment, and what would be your recommendation number one for schools?
So thank you very much for the question. Indeed, we have a lot of questions about schools, especially in the Northern Hemisphere, as many schools are starting to consider reopening for the schools for the school year. There are several things that we are learning about this virus, and we are learning every day something new about this virus, thanks to the incredible work by public health professionals, frontline workers, researchers all over the world. So a special thank you to everyone conducting high-quality research. With regards to schools, we know that schools operate in communities. They don't operate in isolation. So the big thing that we look for is what does transmission look like in the community where those schools operate? So that's first and foremost to really understand. We need to bring transmission under control in the communities where the schools operate. As it relates to SARS-CoV-2 infection among children, there's three things that we are looking at. And we're working with a technical advisory group that we have pulled together to help advise us. We're working with UNICEF, we're working with UNESCO, we're working with a number of partners to consolidate our understanding about this disease in children. First of all, what type of disease is caused in children? And so luckily, the vast majority of children who are infected with the SARS-CoV-2 virus appear to have mild disease or asymptomatic infection, and that's good news. But there are young children, there are children that can develop severe disease, and there are children who have died from infection. The second thing that we look at is the amount of infection that is actually happening among children. And this is difficult to measure because most children have mild disease or asymptomatic infection, and so they're not picked up normally with current surveillance systems. So we have seroepidemiology studies that are conducted that looks at if a child had been infected, and this is measured through antibodies. There are a number of studies that are underway, and so the data is still preliminary, and we're looking at studies that look at all the population. What we see from some of the preliminary results of the seroepidemiology studies is that there is some difference in the infection rate among the youngest children versus older children, teenagers. So we do need to distinguish children by age group. The last thing that we look at, the third thing that we look at, not the last thing, the third thing that we look at is transmission among children. And again, most schools, many schools were closed in this beginning of this pandemic. Not all countries closed their schools, but many did. And so many of the children were removed from the school system and brought home. And we know from household transmission studies that children can be infected, and we know that adults can infect children, and we also know that children can infect adults, although that appears to happen less frequently. But again, if we look at transmission, we need to break children down by age group. And there appears to be less transmission among the youngest kids versus kids who are in their teenage years. So this data is preliminary, but the bottom line is that children can be infected. Most children have mild disease, although some children can have serious disease and some children can die. Children can transmit the virus, although there are differences in transmission rate depending on the age, with the youngest children transmitting less. And these are studies that are ongoing. So if there's transmission that's happening in a community, it can enter into the school system. So what we really need to focus on is bringing transmission down in the school system. We have outlined guidance on how schools can reopen safely. Everyone agrees how important it is that schools are operating safely, and we've outlined how that can be done in terms of physical distancing and hand hygiene stations, respiratory etiquette, the potential use of masks by either the workers or the children themselves. And so there are a number of considerations of how the schools can be opened. But again, we really need to focus on reducing transmission in the community first.
Thank you very much, Dr. Van Kerkhove. The next question comes from Elaine from Health Policy Watch. Elaine, can you unmute yourself and go ahead and ask your question?
Hi, thank you for taking my question. We saw last night